As humans, we yearn for connection, laughter with loved ones, the thrill of exploration, and the joy of experiencing new adventures. We crave vitality and the relentless pursuit of living every moment to its fullest. But what happens when you cannot live the life that you want, that you deserve, due to lack of energy, brain fog, depression, memory loss, ADHD, high blood pressure, heart problems, type 2 diabetes, erectile dysfunction, decreased sex drive, and kidney disease? That was a mouthful, wasn't it? But there is a common factor, an underlying disease that can manifest as one of the diseases I mentioned earlier. At least 24 million Americans don't know they have it because no one has told them about it. And that is the reason why we will embark on a journey to discover the unseen ties between our health and the rhythms of our sleep by exploring sleep apnea. I am Dr. Priti Dagli, a dentist from New Jersey, and this is my Oxford Talk. Why a dentist is talking about sleep apnea? Shouldn't she be talking about toothache or gum disease? For the past 20 years, I was doing just that, and I've saved many smiles. While doing so, I encountered countless broken teeth, lost fillings, fractured crowns, bridges, failed implants, bone loss, gum recession, TMJ pain, jaw pain, all caused by grinding or clenching, which were often linked to stress. But people who said they are not stressed still experience them. So I started educating myself on why patients with perfectly good lives with zero anxiety were still grinding and breaking their teeth. And that's when I stumbled upon the connection between sleep apnea and dental health. So what is sleep apnea? Just imagine for a moment that you couldn't breathe, that every time you drifted off to sleep, your breath would simply stop. No air in, no air out. It's a terrifying thought, isn't it? Now let's try something. Pinch your nose with one hand, hold your breath, do not speak, and count to 10 with your other hand. And this, my friends, is sleep apnea. When you completely stop breathing for 10 seconds or more, multiple times throughout the night, sometimes accompanied with snoring. So why is it important, you ask? You see, sleep apnea isn't just about snoring or feeling tired during the day. If left untreated, it is a serious condition that can have far-reaching effects. It can lead to heart attack, stroke, and in rare cases, even death. And yet, so many people are unaware that they have it. In fact, globally, almost 1 billion people suffer from sleep apnea and only 50 million are getting treatment. That is a shockingly low number. I personally believe that sleep apnea is as important as any other pressing social or political issue, because our survival and the survival of our future generations depends on how we eradicate this problem using a unified medical and dental approach. When a patient walks through the front door, in addition to the history and a simple set of questions designed to uncover the signs and symptoms of sleep apnea, like snoring, fatigue, and daytime sleepiness, I also use my own groundbreaking screening tool called HAS system. H stands for habits, which is grinding, clenching, mouth breathing, tongue thrust, and others. Airway, does the CBCT, a 3D X-ray, show if it is large enough? If not, what are the contributing factors? And structure. Which anatomical structures are responsible for the signs leading to sleep apnea, like narrow upper and lower jaws, scalloped tongue, and others? Since there is very little awareness of the dental health and sleep apnea connection, when I started using my HAS system, I have come across many misconceptions amongst people. This brings me to the top 2 myths that I want to address today. Myth number 1: grinding your teeth and snoring are totally unrelated, and a night guard can fix everything. Night guards are commonly recommended to people who complain about grinding their teeth at night. One of my patients, let's call him Billy, he came to see me for the same reason. His wife couldn't stand his snoring and teeth grinding anymore and kicked him out of their bedroom. We have a new term for this now called sleep divorce. Well, Billy's wife was right about his teeth grinding, but was it just stress from work causing it, or something more serious like lack of oxygen to his body? More than that, will their marriage survive? In Billy's case, we did the history and questionnaire, followed by the HAS system for screening: habits, airway, structure. He was a middle-aged man with type 2 diabetes, always tired, waking up with headaches and stiff jaw. Habits included snoring and grinding his teeth. Airway was narrow, as seen on CBCT. Structurally, he had smaller upper and lower jaws and a high arch palate like a tent. Now, ideal palate is wide and flat. The roof of your mouth is also the floor of the nose. With a tent-shaped palate, the nasal nares had become narrower with a deviated nasal septum, thus making it difficult to get enough air while he slept. Structurally, he also had a large scalloped tongue. Have you ever been told your tongue is too big for your mouth? In reality, our tongues are not getting larger, but our jaw sizes have gotten smaller over time. And of course, he had multiple fractured teeth and some lost fillings. Each time he slept, his tongue didn't have enough space due to narrow jaws and would fall back, blocking the airway. So his body's reflex was to move his jaw forward, grinding his teeth. He had a sleep study and was diagnosed with sleep apnea. A night guard would have made his sleep apnea worse by reducing the tongue space. A study has found that about 1/4 of people with sleep apnea grind their teeth at night. I made Billy an oral appliance to bring his jaw forward, open up his airway, which not only improved his sleep apnea but also his snoring, and ended his sleep divorce. So we not only saved his life but also his marriage. Myth number 2: only obese people suffer from sleep apnea. 40% of my patients are surprised when I suspect sleep apnea. Rightfully so. They are slender, active, and follow a healthy lifestyle. While obesity is a leading cause, there are other factors too. Let me tell you about John. John, a physically fit 50-year-old guy, came to my practice. "Doc, I have terrible breath." John had chronic gum disease. After a laser-assisted deep cleaning, I urged him to undergo a sleep study. He returned with a diagnosis of sleep apnea. So as a dentist, what made me suspect sleep apnea? The history and questionnaire revealed high blood pressure, fatigue, and daytime sleepiness. I followed it up with my HAS system: habits, airway, structure. He was a habitual mouth breather, which made his lower jaw rotate downward and backward, compromising his airway, causing dry mouth and eventually leading to gum disease. His airway was narrow as CBCT, and structurally, he had a redundant soft palate, blocking the airway, severe tongue tie, not letting him lift the tongue up to place the tongue on an ideal spot just behind our front 2 teeth, letting it slide back into the lower airway and thus compromising his breathing. These findings raised red flags for potential sleep apnea in John. He was treated with a painless, non invasive CO2 laser therapy to tighten the tissue and decrease snoring. In addition to the appliance, he was directed to practice nasal breathing. In the future, we may consider a tongue tie release with myofunctional therapy. By addressing the underlying causes of his sleep apnea, we hopefully prevented any future life-threatening health issues. Currently, we have a myriad of treatment modalities available to treat sleep apnea. But there is a huge gap in awareness and actual treatment that can only be bridged through education of patients, doctors, and dentists alike. Billy and John are just two of the few who have been lucky to be diagnosed early on and be treated because I took upon myself to get educated. But not everyone is as lucky. My father had been a heart patient since he was 27 years old. He took multiple medications for high blood pressure, uncontrolled burping due to acid reflux, had a bypass, pacemaker, and eventually passed away at 68. When he visited me 15 years ago, I was shocked to see that most of his back teeth had broken. I was not aware of the correlation between grinding and clenching your teeth and sleep apnea, let alone between sleep apnea and the heart problems at the time. You can see only what you know. We were late in diagnosing the root cause of all the diseases that cropped from the underlying undiagnosed sleep apnea. If there was enough awareness and the knowledge at the time, he would have been here with us, spending time with his grandkids. And that is why I, Dr. Priti Dagli, have made it my mission to raise awareness regarding sleep apnea, its connection to dental health, and hopefully save more lives and families and our future generations. Join me on this journey. Thank you.